and go.
Come in and have a seat. Hi there, my name's Samantha. Nice to meet you. So I understand you've come for a pipelle. I'm just going to tell you a little bit about what a pipelle is. So we need to know why you want to have it. So what we're trying to do is take a sample of the lining of the womb to find out if there's anything worrying going on. It's actually really rare that it's anything worrying, but it's a really safe and, for most people, an easy test, but it can be a little bit sore and crampy. So I hope you've taken a little bit of pain relief before you come in from the letter, some ibuprofen and some paracetamol. And what we're going to do shortly is you can go to the bathroom, and then you're going to go over to the bed. You're going to pop up on the bed and take off your trousers and your undies and pop them on the little stool. And then first of all, I'm going to do your blood pressure, have a little feel of your tummy. And then after that, I'm going to pop your legs in the lithotomy position, so it's in the stirrups. That can be a little bit daunting, but actually it makes my life, and therefore your life, a little bit easier, because it makes the procedure quicker and actually helps your body relax, even though it seems a bit strange, so it's less uncomfortable. And then what I do is I have a little feel for the position of your womb and what the cervix feels like. And then using a speculum, and I'll show you what that is, I'll have a look inside the vagina and have a look at the cervix and the neck of the womb. And then I pass a little tube, a pipelle, into the womb, and there's a little bit of suction on that helps bring out a sample of the womb. Afterwards, you might have a little bit of bleeding. There is a little bit of a risk of infection, but to be honest, I don't think I've had any of those yet. So if you have any worsening pain or bleeding or funny discharge afterwards, then you've got our email address or our number, so give us a call. It should only take a few minutes. It generally takes longer to get it all set up and to make sure you're comfortable. Sometimes we can't do the sample because your body just isn't letting us in, your cervix is tight shut, and that's okay. There are a couple of things that we can do, and I'll talk them through with you if and when needed, because there are some other options. And sometimes we really need the sample and I just can't do it, or it's too much for you or too uncomfortable. So you can just tell me to stop at any time. And then if we need to do a step further, that's when I write a letter to the gynecologist asking them if they can check the lining of your womb out to see if there's anything else that needs doing. Afterwards, you can have a little lie down for a bit on the bed, there's no rush, and then hopefully you'll feel well enough to go home. You might have a little bit of bleeding or spotting, but it shouldn't be too heavy, and it should get better over the next couple of days. I do generally recommend no tampons and no sex for a few days, because it's obviously I've just done a bit of an intimate procedure, so to be honest, to me that makes sense. We can also do a smear at the same time and swabs, and I generally feel that actually you've come here, this is, it's a pretty challenging experience, it's very intimate and quite personal and private. So what I tend to do is do everything at the same time, so do all the swabs, your smear and the sample. And for some people, you'll be interested in having a Mirena. That's a little T-shaped device that sits in the womb as contraception, can help periods, and also as endometrial protection if you're on hormone therapy. So if you want one of those, then I try to do it at the same time, just to minimise the times that you have to come back or see other doctors.